Much, Kimberly, and good afternoon, and thank you for joining us. So to continue the conversation from last week, I just want to remind folks that masks are still required in Milwaukee County high-risk essential service facilities. And so if you think about what facilities those are, that is the Milwaukee County Courthouse, that's our House of Corrections, the County Jail Facility, the Behavioral Health Services Hospital, the Youth Detention Center, as well as the Marshall Cox Human Service Center. And when you think about these particular settings, masks are still going to be required for both our employees as well as members of the public. And when you think about the Milwaukee Mitchell International Airport, as well as the Milwaukee County buses, those will have to continue to adhere to our federal guidelines. And although the general mask ordinance has been lifted, everyone still needs to respect each individual's right to continue to mask on their own. It is their choice. And so we do not know what others are living with, or know who lives that are, the lives in their immediate circle that they're looking to protect. So let's make sure that we always keep in mind that we all live with different risk levels, and high quality masking still remains a helpful mitigation tool based on your individual risk level. And so some businesses you walk into, they may still choose to keep their mask mandates in place, even as ordinances are lifted. But it is a good idea, and I would tell everybody it's a good idea to continue to always carry a mask with you just in case. And as a county, we're going to continue to monitor COVID-19 levels in the community and adjust our guidelines as needed. And so although COVID-19 cases are decreasing and we're seeing a promise in the downward trends that we're seeing, we must continue to emphasize the importance related to getting vaccinated as well as getting boosted. It is still the number one defense that you have against this virus. But to pivot a little bit, I want to also talk about what's happening this Thursday. So this Thursday, March 10th at 10 a.m., I will be hosting the first in a series of community health and healing events that's going to be located at the Black Historical Museum. And so this listening session is going to include local leaders in mental health, who will discuss mental health awareness and having access to mental health services, and really speaking to how the pandemic has really impacted mental health. And these sessions are in collaboration with the county's Department of Health and Human Services, and we're going to continue these over the next coming weeks as well as months. So these community listening sessions, they will be live streamed on my YouTube page, but also posted to the DHHS website and Facebook page. So if you are available, please tune in. But also next week, we're changing things up with our COVID-19 briefings. And so instead of our normal Tuesday briefing over Zoom, Mayor Johnson, the team, and I, we're going to be hosting a COVID-19 community update and town hall on Monday, March 14th. And that's going to be held from 5:30 to 6:30 p.m. at North Division High School. And this town hall is landing exactly one day after the 2-year anniversary of COVID-19, the first case being detected right here in Milwaukee County. And so we want to be able to create a safe and intimate space that can foster some open dialogue and help us exchange some conversations, some questions for individuals in the public, so they can also have their voice heard as well. And so I just want to say, hopefully, if you are available on March 14th, please come out to North Division High School. And so I'm going to pass it over to Mayor Johnson, who's going to talk about the purpose of this in-person town hall, but also be able to speak more to the in-person briefing as well. So with that, I'll pass it over to Mayor Johnson.
Great. Thank you very much, County Executive Crowley, and good afternoon, everyone. To echo the words of the County Executive, it's a great sign of our progress on COVID that we're now able to hold an in-person press briefing next Monday for families of the North Division High School and surrounding elementary and middle schools. Our case numbers are low enough that we feel confident to switch to this alternative briefing style and to get back out into the community. Having public health and medical experts available for small group discussions with residents will be helpful in moving forward on our efforts to increase vaccination in the city as well as the county. I also want to reiterate that last week, the city's mask ordinance and masking requirement for city facilities ended. As the county executive shared, you should carry a mask with you when you leave the house because you never know where you might need it. Many schools, healthcare facilities, public transportation, other businesses may continue to require masks. In addition, you don't always know the circumstances of others around you. So be kind and be understanding. If others are wearing masks and it makes them more comfortable, maybe you can consider mirroring their behavior and wearing a mask as well. Now, on to our gating metrics for the week here. We remain in the moderate transmission category for COVID-19 cases per 100,000, down to 31.5 cases per 100,000. And our percent positivity remains in the low transmission category, down to 2.1%. Our vaccination rates, 63.6% of city of Milwaukee adults, those again are individuals 16 years of age or older, are fully vaccinated, and 45.8% are fully vaccinated along with the booster shot as well. Milwaukee County is also now in the low COVID community level as categorized by the Centers for Disease Control. CDC guidance for the low level states that those who are fully vaccinated can now feel safe removing their masks in public spaces. While in the low level, the CDC still recommends that individuals stay up to date on COVID-19 vaccinations and boosters, continue to get tested, isolate, and quarantine if exposed to COVID-19 or have symptoms of the disease. Take precautions if you're immunocompromised or at a higher risk for severe disease. Throughout the pandemic, the health department has adapted and adjusted staffing as conditions change. With the positive disease trends, we're modifying the way the health department provides services at our health centers. So slight changes are coming to the COVID-19 vaccine services at the Northwest Health Center as well as the Southside Health Center. So beginning on Thursday, March 10th, COVID-19 services at the Southside Health Center will remain in the tents outside of the center, but will transition from drive-through to walk-in. COVID-19 vaccines at the Northwest Health Center will move out of the former Mill Road Library and into the health center. COVID-19 tests will remain available via drive-through in the garage. The Menominee Valley site will remain the same for the time being. I'd like to extend a big thank you as well to the Milwaukee Public Library for allowing the health department to use the former Mill Road Library to administer vaccines. Hours for these services will not change. They remain. So it'll be Mondays and Fridays, 9 a.m. until 3 p.m., Tuesdays and Thursdays from 12 p.m. until 6 p.m., and Saturdays from 9 a.m. until 1 p.m. at the Northwest and Southside Health Centers. On Mondays, Wednesdays, and Fridays from 12 p.m. until 6 p.m., and Tuesdays and Thursdays from 9 a.m. until 3 p.m. at the Menominee Valley site. Looking forward, the health department has one mobile vaccine clinic available for members of the public this week, tomorrow, March 9th from 1 to 4 p.m. at Ascension All Saint Family Health Center. The health department is now focusing its vaccine efforts on providing second doses and booster doses to those who have not yet received them, utilizing available vaccine data. And with that, I think I kick it over to Dr. Weston, I want to say.
All right, thank you, Mr. Mayor. Good afternoon. First to our numbers, we're currently seeing in Milwaukee County an average of 51 new cases per day and 0 deaths per day. It's been a while since we've been able to say that, but indeed our 7-day average for COVID deaths is 0. Milwaukee County last Thursday moved into the green category for CDC community levels, and our trends are excellent. Our cases, positivity, hospitalizations, and deaths are all reaching low levels that we haven't seen in months. And while green is good, and green means that you can pull back on some mitigation measures, our cases and hospitalizations still have room to fall. And many folks out there may still feel more comfortable and prefer, in some settings, wearing a mask and keeping their distance. Now, this may be due to their vulnerability. It may be due to their family members' vulnerability, or their concern for their community's vulnerability. And this is why Milwaukee County will continue at this time to require masks in high-risk facilities and those that provide essential services, including the courthouse. Although our numbers are improving, we're still in a dynamic pandemic. We want to do our best to ensure safety to everyone we serve. Now, in this time of transition, let us all please be respectful of the choices others make when we see this low disease burden. And let us be thankful for the trends that we're seeing and hopeful that they'll last. But in the words of Dr. Osterholm, hope is not a strategy. Pursuing equity in vaccinations and boosters And moving forward with a data-informed approach is a strategy, and the one that we will pursue. Now, transitioning a bit, one of the byproducts of the pandemic over the last 2 years has been an increase in deferred health maintenance. This deferred care can take many different forms, from childhood vaccinations and general physical exams to delayed operations or cancer screenings. And each instance of deferred care can have profound effects on that individual. A breakthrough case of a deadly vaccine-preventable disease in a child, or prolonged untreated high blood pressure that leads to a stroke or a heart attack. The hernia that turns from a simple procedure to a major emergency surgery. Or a colon cancer or breast cancer that, when found early, may be quite manageable, but when delayed, is anything but. Delayed medical care has been a critical issue nationally as well as locally. A study on this was published just last week. I shared the details on Twitter, but they found that 27% of people reported delaying their medical care during the pandemic. Importantly, those numbers trended higher for those with poorer health status, those with worsened mental health conditions, and those with lower income. In short, our more vulnerable populations were more likely to delay medical care. This is why equity matters, access matters. And at these levels, delayed care will impact not only the individual, but the community as well. With increased disease burden from heart disease, from strokes, from cancer, as well as increased health system access downstream when the problems are exacerbated rather than upstream when they're preventable. This is a crisis within the crisis, but the data presents an opportunity for targeted interventions to ensure equity in access to care, and particularly equity in the ability of our most vulnerable to catch up on health care that was missed over the last 2 years. There's not a much safer public space right now than our health systems. Masks are required. Testing is constant. Vaccination of staff is mandatory, all to protect you, the patient, to ensure that you can receive the care that you need. So if you've put off your doctor's visit, if you've delayed your testing, your colonoscopy, your mammogram, now is the time. Our clinics and our hospitals are open. They're safe, and they're ready to care for you and help you to be healthy. Thank you and stay safe, and I'll hand it to Dr. Mary DeWaters from Outreach Community Health Center.
Hi, everyone. Thank you so much for inviting me to this meeting. It's really important to talk about prevention, even when it sometimes feels like the world's on fire. So I'm here to talk to you a little bit more about why preventive care is so important, why we do all these screenings, why us doctors and us healthcare providers want to see you so frequently. So we screen for illnesses for a lot of different reasons. We screen because to some extent we can prevent illnesses. So for example, increasing our HPV vaccinations in teenage populations and young adult populations decreases risks of cervical cancer. Reminders from your provider to eat healthy and exercise can decrease your risk of heart disease and stroke. It's also important because we can treat things more easily earlier. It's a lot easier to treat someone with a colon polyp than with a colon cancer. It's a lot easier to treat someone who struggles with drinking than someone years later who has liver disease or liver failure. We screen for illness because it costs less. Treating breast cancer earlier at stage 1 divides your cost in half as a patient and as a system than it would at stage 4. And one of the major reasons that we screen for illnesses is because we have these amazing resources, especially in the Milwaukee area and in Wisconsin in general, to help decrease long-term problems associated with small things that we can intervene. So, for example, we have the Birth to 3 program, which helps kiddos who have speech delays or other neurological issues so that they can come back and meet those milestones. We have Lead Safe Milwaukee to help with kiddos who are exposed to lead to help decrease their risk of long-term damage from that lead. We see kiddos especially really frequently in the first year so that we can make sure they're meeting those milestones, so that we can make sure that their newborn screen is normal, and if it's not normal, that we can intervene immediately. And we also continue to screen, especially for lead exposure in kiddos until age 5, to make sure that we prevent as much side effect from lead as we can. When we see kiddos a little bit older, from ages 6 to 18, one of the reasons we're seeing them annually is to make sure that they are keeping up in school, they're keeping up with their growth, to make sure that they're not gaining weight as it relates to this pandemic especially. I know a lot of kiddos are exercising a little bit less because parents don't feel as comfortable sending them to their sports games and their practices. We see young adults to make sure that they learn how to have lifelong health, to help them make positive patterns in their behaviors, like exercising, like eating healthy. Then we start kind of middling adult ranges. We start seeing women for pap smears. We start seeing both men and women for relationship safety, for making sure that their lifestyles are again healthy. When adults reach the age of 50, we start screening for colon cancers that, when caught early, can really decrease the amount of trauma associated with that diagnosis. We can start screening for breast cancer, for alcohol and unhealthy drug use, for intimate partner violence, and even for lung cancer, to make sure that if there is an illness, that we can intervene as early as possible so that we can make sure they stay safe and healthy for as long as we can keep them safe and healthy. Now, I know a lot of people are concerned about going to the doctor because of the pandemic. I know that people are worried about getting COVID from coming to see us. But I promise that the healthcare agencies in Milwaukee are doing everything that we can to make sure that we're keeping you safe from the virus as much as we can. One way we're doing that is that 90% of us are vaccinated. Some clinics are even higher. Our clinic is 95%. We're also requiring masks for everyone involved. We're requiring masks for patients, for staff, for everyone. We're even offering virtual visits so that there's fewer people in the waiting room, so that you're less likely to catch it from sitting in the waiting room. We're also requiring patients who have symptoms of the illness or are exposed to the illness to be tested before they come in, just to make sure we keep you as safe as we can. The most important thing to remember about healthcare is an ounce of prevention is worth a pound of cure. So everything that we can do, we are. And if you guys have any questions, I believe we can open up the chat.
All right, Dr. DeWaters, thank you so much. First question comes to us from Emily with CBS 58, and this question is for Dr. Weston. Dr. Weston, she says, you posted about COVID's long-term effects on brain structure. Can you delve into that study just a little bit more?
Sure. So this was a study on people aged 50 to 81. And what they did is they did brain scans before and after infection. And they compared people who had COVID to people who didn't. And on the brain scans of the folks who had COVID, they found a number of concerning findings. So they found reduction in gray matter. That's part of the brain that helps with brain function. They found decreases in brain size. They found evidence of cognitive decline. And so what these implications are needs more study. But the fact of the matter is that we're learning more and more every day about COVID and about the effects that COVID can have, both short-term and long-term. This talks about effects on the brain, but we've heard before about effects obviously on the lungs, also on the heart, on your blood vessels causing clotting and strokes, on your pancreas leading to diabetes, as well as many other organ systems. So I think the take-home point is there's a lot of reasons not to get COVID, and this is one more reason. And the best way not to get COVID, the most important layer of protection, is that vaccine and that booster. So now more than ever, we have a lull in disease activity. This is the time to go out get vaccinated. We don't know what comes next, but we know that we're not done with COVID. And we know that's the best way to keep yourself protected.
The next question is for both the mayor and the county executive. And this question is from Chuck Hornbach. And he says, can you provide more explanation, please, on why you hope people attend Monday night session at North Division? What's in it for the citizens?
Great question, Chuck. So at the end of the day, this is really about us bringing information to the community. We've been doing this over Zoom for 2 years. This is really to bring information directly to them, but also provide an opportunity for them to be able to ask not only us as elected officials questions, but as well as public health officials as well. And so this is really an opportunity to have dialogue with the community. But also, you know, I don't know about you, but I think all of us have been a little Zoom fatigue when you think about how we've been doing these COVID-19 press briefings. So switching it up just a little bit, but I think it's an opportunity for us to connect with the community.
Totally agree with what the county executive said. People are engaged and they want to know more about COVID, especially as we're getting to the point now where some of the restrictions are being lightened up in terms of masking and the like. So folks, I think are going to want to continue to get information about what the community status is on COVID as we look to continue to do what we've been trying to do for the past 2 years, and that's get us back to some semblance of normalcy. And so that's what we're trying to do. We're trying to engage with folks in a I'm going to say a new way, but is really the old way, in a way that I think folks are really ready to gravitate towards as well.
All right, an additional question from Chuck. He says, actually, this is a question that I think we'll take perhaps separately, Chuck, related to Lincoln Hills. So I appreciate this question, and we'll answer that question separately. Any other questions related to COVID? Going once, going twice. All right, Emily, thanks. Emily is asking if there's any word on the masking policy change at MPS. County Executive?
I have not heard of any change. That may be a question directly to ask the MPS school board or the superintendent.
Okay.
Yeah, same here. There's been no new news on masking in Milwaukee Public Schools that I'm aware of.
Okay, all right. So connecting with MPS, Emily, may be the best strategy for that one. Any other COVID-19 related questions from this group? All right. Well, we appreciate all of you joining us today, and we will look forward to seeing you next week. But remember, next week we will not be here on Zoom. Next week we'll be at North Division on Monday at 5:30, and we'll look forward to seeing you then. If you have any other questions for us, certainly you can reach me separately. All right. Thanks, everyone. Have a great day.
Thanks, everyone.
Thanks all. Bye-bye.
Thank you.